Nice. Hey guys, Dr. Will here from Miami Spinal Performance in Hollywood, Florida. Today we have Ian in the office. Ian started lifting weights last week for the first time ever, and now he is feeling it. So Ian's come in with some tightness in his erector spinae. Obviously the guy works out a lot. He's currently training to be a firefighter. So there's obviously a lot of physical demands associated with that, but he also has to spend a lot of time in the classroom sitting. So right now, his low back is all jammed up. His SI joints are jammed up. So I'm going to show you today how we take something like this and make them new. So today we're going to do an adjustment. I'm going to show you guys how I use shockwave therapy, which you know that I love, to help cool down his muscles in his lower back. And then I'm going to show you guys how I use cupping, which I usually reserve for bigger guys like this who come in with tons and tons of muscle tension. So Ian, I'm going to have you lie face up for me, please. Good. Lie on your right side. Bring your head this way. So Ian has something unique that I typically see in bodybuilders, which is his thoracic spine is actually fairly flat, whereas most people have this rounded posture. He's actually very, very upright. Typically when you do a lot of training for your back and your lats, you end up being very, very upright with your shoulders back. So he's not somebody that necessarily needs a lot of adjusting in the thoracic spine. For him, it's going to be more SI joints and more in the neck. Take a big breath in. Good. Other side. Control side. So his right SI joint is totally locked up right now, so we'll get some good movement in there. Big breath in. Nice. Face up. Come on up towards me. So he also has a lot of tension in his neck. Typically this is, weightlifting, sitting at a desk. Right side SCM, right side trap. So he would be another guy that would benefit from a lot of soft tissue work. So here we're looking at C4 on the left side and C4 on the right side. Same vertebrae on both sides, it's out. All right, we are now doing some cupping with Ian. So I'm putting on the last few cups to his lower back. Today, mostly what we were focusing on was getting these cups on his Erector Spinae and QL, as well as a few up on the glute there. So these are going to be the last two. A lot of people always ask me, what does this do or what's the benefit of cupping? So if you look at the cups here, you can see that the skin under the cup is changing color a little bit. The reason for that is the cup is actually pulling the skin and the muscle up and freeing up space for the blood vessels to dilate. When you have dilation of the blood vessels, you get more nutrients, oxygen, anti-inflammatory chemicals all coming to that area. So that's why you end up with these kind of, looks like you got attacked by an octopus after you get cupping, because you're having a rush of blood flow to the area. So typically patients will feel more relaxed, they'll feel a decrease in pain. Now the cupping experience itself, sometimes the suction can be a little bit uncomfortable because it's really getting deep into the muscle and it's kind of opening things up a little bit. But I've had tons of cases where, one thing doesn't work, whether it's adjustments or decompression, or they saw this physical therapist, they did this. As soon as we start doing cupping, the condition is resolved, especially for lower back pain. This is one of my absolute main ways that I treat lower back pain, in addition to, of course, the other therapies that you've seen, but cupping is extremely effective. So I'm going to let Ian sit here and marinate for about 10 more minutes with these cups. Thank you guys for watching. I hope you enjoyed. If you have any questions, please drop a comment, or you can reach out to me through my website or through Instagram. Dr. Will, out.